Good evening and welcome to our Breastfeeding Awareness Zoom call. It's a collaboration between Potential and three incredible dietitians who so graciously gave of their time to share their insights with relation to breastfeeding. So we're just going to start by introducing everyone. So I'll start and then I'll just ask Michaela, Melissa, and Nadine to just introduce themselves and just maybe indicate their name and just what they do. So I'll start. I'm Bernali Mashaka and I'm one of the Potential team members. And then Michaela.
Hi, my name is Michaela and I'm a registered community service dietitian. I'm based in the Northwest. I'm at Twying sub-district. And I am passionate about breastfeeding. I'm also studying to be a lactation consultant, an SACLC.
Thank you, Michaela. Now Nadine.
Hi, I'm Nadine. I'm a registered community service dietitian. I'm based at KZN at Queen Nandi Hospital, which is a mom and baby hospital, so focusing more on pediatrics.
Thank you so much, Nadine. That's so interesting. And then Melissa, if you could just introduce yourself, please.
Hi, everyone. I'm Melissa. I'm a registered dietitian at Sabe Hospital in Mpumalanga, and I've been working there for about 7 years. We do work on rotation within the wards, but I do have a lot of experience working in the maternity unit and working with breastfeeding, so I believe I can bring something to the table today.
Yes, we definitely believe you have so much more insight into it. So thank you so much for offering your time. Now we're just going to introduce the Potential team members, just starting with Logan, Cameron, Kazim, and then Nahia.
Okay, so I'm Logan Julius, and I'm a final year occupational therapy student, and currently working from home in the Western Cape.
Okay, then I'll go. I'm Tamlin, and I'm also part of the Potential team and OT student, and I'm currently in Tuning, working from home in Limpopo.
Hello, I'm Tasneem. I'm also an occupational therapy student, and I'm working from Bloemfontein in the Free State, also from home.
Sorry, hello everyone, I'm Navya. I'm also from Cape Town and I'm part of the Potential team. I'm currently living in the Strand area, also working from home. So yeah, it's just nice to meet everyone.
So now that we've got all the introductions in the way, we're going to hop right into the questions and answering thereof. So the first question is, why is breastfeeding important?
Hi, it's Nadine again. So, well, breastfeeding has so many benefits. As most of the general public are aware that breastfeeding is important, just to go into that into a bit more detail, breast milk is perfectly designed for your baby. It's designer milk, like one of my supervisors used to say. It's got the perfect concentration of proteins, fats, carbohydrates that baby needs to grow. So moms don't need to worry about, if you could say, mixing incorrectly or temperatures, because it is naturally warm because it's from the mother's breast. Also, what's so special about breastfeeding is they found that breastfed babies have higher IQ scores than formula-fed babies, and this was found in a study in Brazil. And so it's because of the natural fats that are in breast milk that we don't find in formula that help with baby's brain development. So later on, the rest of their development, which falls into OT. It also has special immunoglobulins. So these are immune boosters which can protect babies from infections and illnesses outside the womb to keep them strong and healthy, as well as perfect concentrations of vitamins, minerals, and even some enzymes to help babies digest the carbs, proteins, and fats. Breast milk also has benefits for the mom, which include having a lower risk for ovarian and cervical cancer, as well as helping them get back to their pre-pregnancy weight. It's cost effective because you're not purchasing formula, saves time. And also, just to hint at our theme for breastfeeding awareness this year, where it's breastfeeding for a healthier planet, breastfeeding also has a positive impact on our planet because a formula is made in a factory. So it's all the air pollution, noise pollution from the factories, as well as the tins ending up in landfills after being used, so not being able to be biodegradable. And also the high use of electricity, so carbon fuels. So breastfeeding is important for every aspect of life, basically.
Thank you so much, Nadine. One can really just see the benefits, and it's not only for mom and the child, but it's also definitely for the environment as well. And I think it's so interesting that it affects so many other spheres in our country as well. So thank you so much for that. And then the second question is, how long should a mother breastfeed?
Right. So the recommendation from the WHO for breastfeeding is that once a mother delivered, breastfeeding should start within 1 hour after delivery. So it's quite soon, but it really does help to improve the breastfeeding, to get it going, to get the bond with mom and baby going. So it's really beneficial. And then for the first 6 months of the baby's life, we recommend exclusive breastfeeding. So that means no water, no juice, no formula, nothing else is needed. If mom feeds the baby on demand whenever he wants, he receives all the nutrients, everything that he needs for adequate growth within that 6 months. It's often something that scares moms because they do think, don't my child need water in that first 6 months? Everything they need is in the breast milk. And then we try to encourage moms to continue breastfeeding for up to 2 years and beyond. So it's a nice long period that they can continue. And the breastfeeding, even after 6 months, when they do start incorporating solid food into the baby's diet, breastfeeding still plays a very vital role in their growth and development. So they should continue as long as they can.
Thank you so much, Melissa. So just the next question is, if a mother is HIV positive, will this affect breastfeeding, or will this affect the child's health in any way?
So in terms of breastfeeding and HIV, it's important that moms continue to breastfeed, and we continue to preach exclusive breastfeeding because the benefits of breastfeeding, as I mentioned before, far outweigh the risk for transmission. I had found that the risk for transmission is higher during pregnancy and delivery than it is during breastfeeding. It's also important that when we're counseling our moms, that moms also remember to take their ARVs, which they should have been on during pregnancy or as soon as they've been diagnosed. Babies are also given prophylaxis that also protects them. And yeah, moms that have drug-resistant HIV, so they're on a second-line treatment most of the time, it is also safe for them to continue breastfeeding. But we always also have to assess the social situation to find out why she's drug-resistant or why her viral load is so high. Yes, so it is safe, perfectly safe for babies to continue to be breastfed exclusively whilst on if mom is HIV positive.
Thank you, Nadine. So just the next question is, what can you do, or what are alternatives if you can't breastfeed?
Okay, so that will depend on the reasons why the mom cannot breastfeed. So let's say, for example, in the first scenario, let's say the baby was born very prematurely, so meaning he doesn't have a proper sucking reflex yet, or he's very ill, he's in the ICU, and mom wants to breastfeed, but baby cannot suckle. something that she can do is to express her breast milk. So that expressed milk will then be given to the baby either via cup or via the nasogastric or orogastric tube. So that's one way for mom to continue breastfeeding. Another scenario might be if, let's say mom doesn't have enough breast milk yet. She wants to breastfeed, but she just can't seem to get enough. Or let's say she's also very ill. Again, they can try to express some breast milk and give that to the baby. And we can also, in some cases, make use of donor breast milk, which we get from registered donor breast milk banks that they can use. It's been tested, it's been treated, and it's very safe to use as an alternative for the baby to still get the benefit of breast milk until mom can give her own breast milk for the baby to use. Also, a concern that some moms have is when they are going back to work, what can they do? As they will be separated from their baby. Again, expressing your breast milk will work in a situation like that, because breast milk can be stored in the fridge and it can even be frozen. So you can store it there, and then you can even, like when you decide to go back to work, a month or two before the time, you can already start pumping out your breast milk. You can put it in the freezer so that you can build up like a stash, so that when you return to work, you know there is some milk available for the baby to use then during the day. When she's reunited with the baby, then she'll just continue breastfeeding as usual. Something that I just want to mention, there is certain cases where breastfeeding might be contraindicated. So it's very rare, but it does happen. So let's say certain metabolic diseases is a contraindication for breastfeeding. So it means it can actually harm the baby. So in certain cases, we will recommend the baby rather to get a specific type of formula. Or if the mom is using some medications. So chemotherapy for one, certain antipsychotic drugs is contraindicated to breastfeed when the moms are using those. So we will assess the situation, and then we will advise on an alternative feeding method for the baby. And then another scenario that we just have to mention is if the mom does choose not to breastfeed. It does happen, although we promote breastfeeding and we want moms to breastfeed, we absolutely cannot force them to do it. So what I do at my facility when I counsel moms, if they choose not to breastfeed, I will just politely ask them, you know, what is your reasons? Why don't you want to breastfeed? And I just make sure that they have all the information to make an informed decision about the infant feeding. So I will double check with them. Maybe they are concerned about HIV and breastfeeding, and I will counsel them on that. Or I will just ask them about their socioeconomics, give them some information about, you know, the cost of giving formula to a baby. You know, they need water, they need electricity, all of those types of things. So we will do those types of counselings and just make sure that they understand the full impact of that. And also the benefits of breastfeeding. If they still choose not to breastfeed, we'll just give the formula feeding information as well and make sure they are educated on that. But yeah, we absolutely cannot force them, although we promote it.
Thank you, Melissa. You mentioned the term express. What exactly does that mean?
So expressed breast milk just means that instead of having the baby sucking on the breast, the mom actually makes use of her hands, or she can use a breast pump to pump out the breast milk, either into a cup, which we usually prefer, or in some cases they will use a bottle, which will then be used to give that milk to the baby. If they're not going to use the milk immediately, so in a case where a mother would be returning to work, that milk can be either stored in the fridge or it can be stored in the freezer, in a freezer safe container until further use. But yeah, expressing breast milk is a very, very good way to sustain breastfeeding in the long term, especially for working moms or moms that have ill babies in hospital, prematures, those types of things.
Thank you so much. So now the next question just revolves around some terms that are used when people usually speak about breastfeeding. And one is latching and positioning. So Michaela, if you could please just enhance something of those two terms.
Okay, so latching is defined as the way your baby attaches at the breast. So if I'm going to use an example of my breast over here, so the way your baby's mouth goes onto the nipple is called latching. So this can make or break the amount of milk that your baby gets. So it's very important for every mom to have a breastfeeding consultation to make sure that she knows exactly how to latch her baby correctly, so that the baby is getting as much milk as he possibly can out. Yeah, okay, so then positioning is the way that your baby is positioned at your breast. So if I was to use, let me just tilt this down. So if I'm going to use my baby as an example here, the way that I hold my baby at my breast is defined as how I'm positioning him at my breast. So this can also make or break the success of your breastfeeding. And there's a few rules that I like to tell moms. The first is tummy to mummy. Okay, so the main thing here is that we want to get the baby facing the mom. We don't want him to be lying flat with his stomach facing up. They need to be flush and tight, held securely against your body. And then we need to make sure that the baby's body is in a straight line. So his ears, his shoulders, and his hips all need to be lined up and held securely against your body like this. So if you can get that right, it means that your baby will be able to get a good latch and make sure that he's going to get enough breast milk out.
Thank you for that demonstration to Michaela. That was really cool and really just allowed us to visualize what it looked like. So thank you. The next question is just, what should the mother's diet consist of to ensure optimal breastfeeding?
Okay, so the reason why I always go on about diet and hydration for moms is because it's really helpful in trying to increase your supply. So again, with latching and positioning, if you're getting the latching and positioning right, you're going to be stimulating your brain to produce more milk. And it's the same thing with your diet and your hydration. If you are getting those things right as well, you again stimulating your supply. So it's really important that you are getting enough calories. So you need to be getting enough energy in order to support the extra need that your body now has because it's trying to make breast milk. So you need to be having 1 or 2 extra snacks a day. It doesn't mean a whole, you're not eating for 2. Let's get that out of the way. So it's just 1 or 2 extra snacks during the day, and that will be enough to support your breastfeeding extra requirement. And then also to try and keep hydrated is very important, because obviously breast milk is a fluid. So if you are not drinking enough water, it could start to decrease your supply. So what I recommend my patients to do is to have a bottle of water with them at all times and just constantly sip at it throughout the day, especially when you're actually breastfeeding. A lot of moms complain that they get really thirsty when they are actually physically breastfeeding. So to always have a little glass of water next to you is really helpful as well.
I just see in the chat, Logan has a question, so we'll just give her opportunity to ask that.
Is there any way that the mother knows that they possibly won't, will there be a sign to the mother to know that she's not eating enough or drinking enough water?
Well, one of the first signs is that the milk supply will decrease. So that's the main goal of trying to meet your requirements, both hydration and diet requirements, because you need to keep up your supply. So that could be one of the first signs. Yeah, I mean, you're not going to see physical signs of deficiency in your child because your body is so self-sacrificing that no matter what you eat, a lot of moms always are worried, and they ask me but I'm not getting enough food, so my baby's not going to get enough food, so I need to start formula feeding. That's not true. It's just it's optimal. When you are eating optimally, your breast milk is optimal. So if you're not eating enough, then your baby will still be getting enough, but it won't be the optimum levels, if you understand.
Yes, I do. Thank you so much, Michaela.
Michaela, I just have 2 questions. Sorry. You mentioned snacks. Do you maybe have example of like what types of snacks mothers could snack on? And then also just with regards to hydration, is there like a recommended amount of water that should be like drunk in the day?
Okay, so the kind of snacks that I'd recommend, I always like to advocate for healthy foods, obviously. I mean, being a dietitian. So we don't want to be snacking on chips and sweets and chocolates and all of those sort of things, which is unfortunately often what we do see in real life. But so I would recommend having things like cottage cheese with Provita, or peanut butter on a piece of toast, or you can have fruit with yogurt. Yeah, like anything that you can think of that would be a healthy snack is more than enough. Like, and you only need 2 of those. So also depending on your size, you might need 1 less. So a more overweight woman would only need 1 extra snack, whereas a more slender woman would need 2 to support the extra nutrient needs. And then, sorry, your other question about the water. So the recommended amount of water is typically about 2 liters of water a day. That's just to support any human, but I mean, it's more important for a woman who's breastfeeding to actually get that amount in. So yeah, so about 8 glasses a day.
Thank you so much, Michaela. So I see Tammy has a question in the chat, so I'm just going to ask Tammy to just ask the question out loud, please.
I just wanted to ask Michaela, how important would it be to take the pregnancy vitamins or the tablets that moms normally take?
So I'm very glad you brought that up. So that's exceptionally important. So moms are often put on iron and folate supplements. Without those supplements, there are huge risks to the baby and to the mother herself. So if you don't take your folate supplements, especially within the first trimester of your pregnancy, it can be very dangerous for your baby's neural development. So babies are actually born with neural defects, so they can actually have very serious life-threatening conditions if you don't have enough folate in your diet. So that's why we supplement, because it's very easy to not get enough folate. And then for iron, it's actually very dangerous for the mom to have postpartum hemorrhage if she doesn't take her iron supplements, and obviously this can be fatal as well for the mother. Yeah, so we really do recommend that every mom, and no matter what socio-demographic background she's from, she needs to be taking her folate and iron supplements from the start.
Just with the folate and the iron supplements, do you need a prescription? Do you need someone like a dietitian or health practitioner to like indicate to you that you should take it, or is it something that you can just go ahead and?
Okay, so it's generally standard practice for every like first line health practitioner to give any pregnant mom those supplements. So no matter where she is, even at my clinics who are in the middle of nowhere, every single time we get a pregnant mom, they get their folate and iron. So it can be dispensed by a nurse, a doctor. Unfortunately, dietitians can't actually do any prescriptions, but it does need to be prescribed by a medical professional. So you can't actually just go and get it. It needs to be at your clinic or your hospital or your wherever you're going to, private practice, no matter where you're going to.
Thank you so much. So the next question is, how often should a mother breastfeed?
Wait, sorry. I keep forgetting that's me. Okay, so it's really important for a mom to be breastfeeding as often as her baby needs to be breastfed. So we call that feeding on demand. So we really want to be encouraging moms to baby watch. So I have an Instagram account where I teach moms about baby watching. It's really important because if you can read your baby's language, then you're going to know exactly when that child is hungry and when he's full and when he's tired and when he's whatever. Okay, so if we can get that right, then we are making sure that every time the baby is hungry, we're feeding him. We don't want to be clock watching, because what that is going to do is just disrupt his satiety signals for himself. So satiety is how full the baby gets, and if we are clock watching, we're going to be giving him food at certain times during the day, and that can actually then disrupt how he interprets his own satiety cues. So if I'm feeding on demand, then my baby learns that, okay, I'm full, I'm going to stop now. But if I'm clock watching, he's not going to learn how to interpret that signal, and that can actually then lead to obesity later in life. So it's really important to learn what our babies are telling us, so that we can feed them intuitively.
Thank you. So the final question is just, how does alcohol and smoking impact the baby? I think that's Melissa.
Okay, so generally speaking, we would like all mothers to avoid smoking and the use of alcohol during breastfeeding. It is something that can be difficult for them. If you look at smoking, we know smoking can increase the risk of a baby having colic if the mom is smoking during the breastfeeding, and it can also affect her milk supply and the milk production. So if we do have a mom that smokes, we try to recommend her to reduce the amount of cigarettes that she is smoking. And we also recommend if she wants to smoke, to maybe first breastfeed the baby and then smoke afterwards, just to limit the nicotine exposure to the baby, and also not to smoke around the baby, because you don't want that secondary smoke exposure for the baby. So you will go outside, wash your hands afterwards. The same goes for alcohol. I'm sure you guys are all aware of the effects of alcohol during pregnancy and what that can do to a baby's development and their mental development, and the fetal alcohol syndrome that can develop in severe alcohol abuse during pregnancy. And so we also don't recommend really using alcohol during pregnancy. So I would usually tell moms, if you don't drink, don't start drinking now, just leave it completely. If you would like to use alcohol, please do so then in moderation and on occasion only. And also try to use alcohol after you breastfeed your baby. So you'll first breastfeed and then you can have a drink. Usually if you just have something small, within 2-3 hours, it would be safe for you to breastfeed again. But if moms are concerned, we will tell them you can pump and dump, if we can call it like that. So you will express the breast milk, discard it then if you are worried about that. But usually within 2 to 3 hours, it is safe to continue to breastfeed if you just took a small amount of alcohol. So that's usually what we recommend. But if you can avoid it, rather be safe and then avoid it.
Thank you, Melissa. I can see in the chat Logan has a question, so we're just going to give her the opportunity to ask that question.
Okay, so I know in most hospitals there's like signs to not to use a bottle to feed the baby, and a sippy cup is preferred. Why is that the case? It's open to anyone to answer.
I can maybe answer that question, or if someone wants to add, they can. So usually we recommend the use of a cup above the use of a bottle for breastfeeding, because when you look at the teeth of a bottle and the shape of the breast, it is different. So what we will often refer to is, we will say it causes nipple confusion in a baby. So when you take a bottle, most bottles, if you turn it upside down, the milk just flows out. It doesn't drop slowly. Where with breastfeeding, the baby has to work to get the milk out. He really has to suckle to get the milk to come out. So just to avoid that nipple confusion, we recommend the moms not to use a bottle. If you look at the way that the proper method of doing cup feeding, the tongue movement that is used when a baby does cup feed is similar to that of the breast. So the risk of nipple confusion is much less. Something else that is also worth it to mention is when moms give bottles, oftentimes it's not breast milk that they put in the bottles. They will breastfeed, maybe they don't feel like it, they go to the shop, they put formula milk in that bottle. Time that baby spent drinking a bottle is not time that they spend on the breast. So your milk production can be affected by that if you do that in the long term. They can get the nipple confusion. They might prefer the bottle above the breast. So we try to get moms that want to breastfeed to avoid using the bottle. I don't know if anyone else wants to add something on that.
I just wanted to add that also with bottles, it's very difficult, especially in rural settings, to clean the teat completely, like so that it's sterile. And what happens is, I mean, I've seen with patients that I've gone to home visits, is that the milk actually sits in the teat itself, in all those little grooves, and it actually rots in there, and it causes the baby to get sick and get bacterial infections. So it's very dangerous to have unsafe bottle feeding compared to a cup, which is a lot easier to clean and can be cleaned with just normal a sponge and some soap, whereas with the bottle teat, you're going to have to get a lot more like serious with your cleaning. And then also with the cup feeding, it also promotes better oral development. So like Melissa was saying, the way that the baby sucks at the cup is more similar to breast, the way that they suck at the breast, and the way that they suck actually affects how their mouth forms. So a lot of babies that have had exclusive bottle feeding will have those teeth that sort of stick out because of the way that they have to suck at the bottle compared to what they would have been sucking at the breast. So it's very good for oral development as well compared to bottle feeding.
Thank you so much. This is now another random question, or not random. What can you advise a mother if their baby is struggling to latch on their breast? And I know there's like this, or like this other, not plastic, but type of thing that you can put over your nipple to promote. Yeah. If you could just maybe give more information about that, or tips on how to promote latching.
Okay, so I was going to talk about this earlier, but I thought I wouldn't do it just in case we ran out of time, but I'll just quickly touch on it now. So I'll just demonstrate how moms should try and get their baby latched at their breast. So the first step is to actually point the nipple up the nose, okay? So if this is my baby's mouth, I'm actually pointing the nipple completely up, like towards the ceiling, okay? It's almost as if you're injecting the baby with milk up its nose, okay? And then as the baby sniffs the nipple, okay, he will open his mouth wide, and we need to wait for that wide gap before we actually push the baby onto the breast. We don't bring the breast to the baby, we push the baby onto the breast, and this lower jaw will actually shove the nipple right towards the back of the mouth where it doesn't get pinched. Okay, so if we are actually shoving the nipple straight like this, the baby will only suck on the nipple and it will pinch the nipple, and this means that there's actually no milk coming out. So I often actually get my moms to whip off their top and do it themselves. So I say to them, okay, squeeze your nipple now and see how much milk comes out, and then squeeze over here, which is the areola, okay, the dark part around the nipple, and squeeze and see how much milk comes out in comparison. And they're all like, oh my word, that's the huge difference, because if you squeeze here, like literally like 3 droplets will come out, but then if you squeeze here, it'll literally shoot across the room. So it's very important that the baby gets deep onto the breast, and by doing that nose to nipple thing and bringing the baby to the breast and not the other way around is very crucial in being able to get that deep latch where the nipple doesn't get pinched. Sorry, I think you had another question, I can't remember.
Yes, that's so interesting. Sorry, Melissa, you can go.
I just wanted to add on something that Michaela said as well. I just think that if a mom is, let's say she delivered, she's breastfeeding in the hospital, she went home and now she's having trouble latching the baby or she's uncomfortable, I think it's very important for her to speak up, to ask for advice rather sooner than later. Because what can happen is the baby can develop a negative, type of relationship, I almost want to say, with the breast. And if they have a negative experience, they don't want to go back there again. So if they do have trouble latching the baby, I would definitely recommend them either seeing their nurse or the dietitian or the lactation consultant that's available to them to assess the breastfeeding and see what is going on. Maybe there's another position that she can be using that would be better suited to latch the baby. Some babies are very tiny, they struggle to latch in certain positions. Other times, maybe the mother has got a very big breast, which makes latching difficult for the baby. So a certain position might be more suited for them. So I would definitely recommend that. And also the therapist can maybe assess to see if there is a reason for the poor latching, a tongue tie maybe, or maybe some reflux or whatever the case might be. So that would definitely also be my recommendation for her to just go get some help sooner rather than later.
Okay. My other question was I'm not sure what material it's made from, but the like almost extension to the nipple thing that you can buy in the shop. I don't know what you call it.
It's called a nipple shield.
Oh, that one.
Okay, so nipple shields are only used when there's problems with breastfeeding. So I will never just put a nipple shield on any old woman who is having like mild issues with breastfeeding. It's more of a last resort, and it's for extreme cases like women that have inverted nipples, or that they have such bad nipple damage from a bad latch that it's so painful that they can't actually get the baby onto the breast without having that nipple shield there. So I would never recommend a mom goes and buys a nipple shield without having any consultation first. She definitely needs someone to prescribe it in a way. I know it is readily available, but I would definitely say to every mom out there, don't self-prescribe. Don't go and get it yourself. Get someone to actually make sure that you actually need it, because what can happen is that the baby gets another sort of nipple confusion. So it makes it very difficult to breastfeed in the long term if you don't really need it. So yeah.
That makes so much sense. Thank you so much. Maybe Nadine can answer this one. Just one last question. In terms of, I know a lot of moms, maybe like a few months down the line, say they have like pain in terms of like the baby biting the nipple, or it's just painful. So is there anything from a dietitian side that is recommended maybe to like soothe the nipple, or any pain, or like bite marks or something that they can use?
Okay, so first what we do is we'd assess baby's positioning and latching, just to see how mom is holding baby, because what often happens is, like Michaela referred to when she was discussing latching, is that the baby may be latching onto the nipple, but not fully onto the breast. So that could be causing pain. We'd also check how mom's taking baby off the breast. Is she just pulling baby off the breast? Because that pulling motion will make it painful, because the babies form like almost like a vacuum seal onto the breast whilst breastfeeding. So we'd assist the mom with techniques with taking off the baby off the breast. So breaking that vacuum by just putting a finger there just by the mouth, by the entrance, and slowly compressing the breast just a little, just to break the vacuum, and then taking the baby off the breast. I wouldn't recommend any creams, not that I know of, but Michaela and Melissa can add anything there if they have anything to say.
So I would recommend that instead of going to creams first, you actually express some breast milk and wipe that onto the affected nipple, because breast milk is so high in antibacterial properties that it can actually start to heal your nipple just by having that on there, and just letting the breast milk actually dry on the nipple. But if it's very severe, then lanolin creams are the next best. But yeah, again, you're going to need to see someone about it to make sure that maybe it's very severe. I mean, there's 4 different stages of nipple damage. So if it's stage 4, which is the worst, then you're really going to need to see a doctor. You're not even a lactation consultant. You'll need to see a doctor as well. So yeah, it depends completely on the woman herself. But yeah, those 2 tips, the breast milk rubbing on there and then lanolin cream, can also help as well.
Okay, thank you so much.
This is so informative. We are just going to open the floor now to the potential team members if anyone has any other questions to ask. Okay. I think you said nipple damage. What are they, and what are like the red flags to really go consult with someone?
Okay. So stage 1 is when you only have like just an inflamed nipple, so it's just redness and tenderness. It's not severe pain yet, it's just sort of tenderness. So that can be caused by latching problems, or it can also be caused by a tongue tie. So that's also going to be needed to be assessed by a dietitian or a lactation consultant. And then also then stage 2 is when you have more severe, but it's still superficial. It's not penetrating your skin quite yet. So when it's actually like scabbing, then that's stage 2. And then stage 3 is when there's actual penetration into your skin. So there's like a you can actually see the inside of your skin. Then that will be a red flag to say, okay, let's get this sorted out and seen by a doctor or a lactation consultant, because that can be infected, because now we penetrating the skin. So and then stage 4 is then very severe. I mean, I've seen moms that have like that much of their nipple like eroded away because of damage by a tongue tie. So yeah, it can vary completely, and all of them probably need to be assessed, except for probably number 1, you can self medicate.
When you say tongue tie, what do you mean by that?
Okay, so a tongue tie is basically, if you, okay, I'm gonna use my own mouth. If I lift up my tongue, can you see that frenulum there? It's like a little flap of skin that's attaching my tongue to my lower jaw. So in infants, it can actually occur that it's very tight, and it can actually prevent the movement of the tongue to be able to like do that normal sucking motion. So some babies can't actually lift their tongue very high at all, and then that can affect the way that they breastfeed. It can cause pain, and it can also affect the way that it can affect how much milk that they actually can get out. So all babies need to be assessed for tongue tie, especially if it is in the family, because it's a genetic trait. So if I have one, it's likely that my baby will have one as well.
Okay, thank you so much.
Okay, so now we are just going to give each dietitian the opportunity, last thought, maybe if they want to emphasize something that they feel is important, or reinforce something that they've mentioned earlier. And we'll just start with Melissa, and then Michaela, and then Nadine.
I think in general, the session was very informative. I think there's a lot that everybody could have learned from this. I think I would just emphasize, if you are a mother, it doesn't matter whether this is your first baby or your second baby, and you have questions about breastfeeding, or you are struggling, don't just stay in your house and suffer in silence. Ask someone. We as dietitians, we are all trained. Usually the midwives, the nurses in the maternity unit, they are all trained on breastfeeding. The lactation consultants are the best people to consult and to ask advice for. So please just ask for advice. We are here to help you. And the longer we can get you to breastfeed, the better for your baby and for your own health. So that would be, from my side, my recommendation.
So my take home would definitely be that breastfeeding is worth it. So a lot of moms will have problems, and it goes with the territory. But as Melissa said, get help, because you can overcome those problems, because at the end of the day, it's going to make the world of difference for both your baby and yourself. So yeah, and I really want to emphasize that latching and positioning can make or break your breastfeeding experience. So if you have a good latch and a good position, you're going to love breastfeeding. But if you don't have a good latch or position, you're going to hate it, and you're going to stop within a few weeks. So it's really, really important that if you are struggling, that you get help, like Melissa said, and so that we can definitely help you.
So I'd just like to mention that during our pandemic, because now we're going through COVID-19, breastfeeding, breast milk is still safe. Moms just need to remember to wash their hands before expressing, when handling their baby, wearing their mask, maintaining social distance, and still applying all those protective measures that we would in our day-to-day lives. So it is safe for a COVID-positive mom to breastfeed her baby, and baby will gain all those benefits from that. And also to remind moms to express, because often what happens is that they breastfeed only and some moms forget to express. So expressing helps keep up your milk supply, and like Melissa mentioned earlier, it helps you build your own supply for when you go back to work. Yeah.
Thank you so much. This was incredibly informative, and really thank you for offering up your time to share your insights. We really do appreciate it. And I'm also viewing this, have learned so much. And just with that, we'd like to ask those of you who haven't followed us on our social media pages, please do follow us at Potential on Facebook, and then also on Instagram. It's at small letter P underscore capital letter OT underscore small letters TENTIAL. And then also Michaela has a really incredible Instagram page also, and it's called at the Mentor Mommy, and it's spelled as well as at, and then THEMENTORMOMMY, and there's no spaces in between that, and they are really, it's really informative, and there's really good information on there, so be sure to give her a follow. Again, thank you so much for this evening. We really do appreciate it, and have a lovely evening further.
Thank you.
Thank you so much.
Thank you so much.
Thank you.
Thanks, guys.
Bye.
Bye.